All right, thank you guys so much again. We welcome you to the show, to the Lift podcast. And like I said, I'm your host, Erica Irvin, and I'm so excited to have you guys. And as you guys are tuning in, remember, like and share. And we just want to give a big welcome to my sister in Christ and, sister in the vineyard, Angela Turner. Thank you so much for joining us, Angela.
Well, thank you for having me.
Yes. Well, we have an exciting topic, and I'm really thankful for her to share her expertise. We're dealing in a time that I feel like we really need to uh, have more knowledge and insight on the medical field. And so we're really wanting to lean and depend on you and, your insight and the things that you've come across, the things that you're experiencing to just kind of get listeners on the right track and on the right path to their road of recovery.
Mhm.
And I think it's very fitting to invite you on to be able to share this space with me and just educate us a little bit. We've had some conversations in the past. We've even talked about CPR.
Yeah.
I was tickled pink on the discussion because I feel like CPR, I thought I knew. I had asked the question, "Are you pregnant?" So in the Marine Corps years ago, we were told, "Ask, are you pregnant?" And so when I mentioned that to Angela, I was like, "Wait a minute, what?" No. And so just some of the information that is definitely updated.
Yeah.
She has a very current perspective on a few things that I would love for her to share. But before we get into it, let us go before God in prayer and just thank God for this opportunity. Father, thank you so much for my sister Angela. And I just ask that you just continue to bless her and just continue to use her mightily for your glory. And I just ask that you bless this conversation, that it be pleasing to you, and that you continue to educate and pour into us as we turn to you and seek your face and seek your ways. I thank you for this opportunity on tonight. Bless the listeners, bless those that are commenting, and just continue to edify and uplift them as they're coming on here, joining in, and just continue to educate the way that only you can. It's in Jesus' name. Amen.
Amen.
So, Angela, tell us about a little bit about yourself.
All right. So I am Angela Turner. I am originally from Arkansas. I am a mother of three beautiful young ladies, and I am married to my high school sweetheart. So I have been very fortunate and very blessed in that I am in a profession um, that I saw people that looked like me practice in. And so they were my influence, they were my guiding light, and they made me feel confident in my abilities, and that there was not anything that would deter me from being able to follow my goals and to pursue a career in healthcare. So I've just been very blessed. I've been very fortunate. And I'm thankful that God has placed my purpose in my life. I felt like at an early age, and I feel like every day I still work within that. So,
Okay, awesome, awesome. Well, and so how did you come to being a nurse?
so it's funny. Like I said earlier, I've just always had examples of African Americans in healthcare. My grandfather was a physician. He was a family
Okay,
practice physician. My
okay.
dad is a pharmacist. His brother is a pharmacist.
Mhm.
His another one of his brothers is a pediatrician who was my pediatrician as a child, and I have an
Awesome.
aunt who is also a family practice physician who practiced with my grandfather.
Okay.
So I've always been surrounded by people in healthcare. But I would say when I knew that that was something I wanted to do, I'll never forget I was in middle school, and one of our fundraisers was for St. Jude. And back then, you had the little paper box, and you would collect the coins, and the
Yes.
trip was to go deliver that to St. Jude, and we did a tour of the center. And I remember walking through those halls and seeing the difference that they were making, and I was like, "This is something that I want to do." So
Mm.
initially, I always thought I'd be a pediatric oncologist who would work at St. Jude's.
Okay.
But life happens, and I got married. We had our first child, and you know, I decided at that time nursing was the way that I needed to go And
Mm.
I've never left or strayed from it. I've never regretted it. I've never felt like it was anything else that I was supposed to do. As long as I was working within the field of healthcare, I feel like this is what I'm supposed to be doing.
Awesome. Awesome. Well, and so what were some of the hindrances or setbacks that you faced in the beginning?
So in the beginning, I think a lot of, especially when I started in nursing, it was very much a field of you have to earn your dues.
Hmm.
So people were welcoming, people were
Hmm.
encouraging, but there was a thought of, you have to work these shifts or work these certain areas before
Yeah.
you earn the ability to have a more reasonable schedule or to
Yeah.
have more weekends off or to have those
Yeah.
holidays off. So that was tricky because when I went into nursing again, my husband was early on in his career and I had a baby at home. So
Mm.
I'd say initially that was a little bit of a hindrance. But other than that, once I got my feet wet, once I earned my stripes,
Yes.
it hasn't been a problem.
Awesome. Awesome. So, okay, how did you get back to basically you're talking about, going in and working the hours and doing what you
Mhm,
needed to do. Um, when you had your baby,
mhm.
did you have a period where you stopped doing it, or that you took a pause, or was it pretty much you just kind of followed through in spite of?
I had not at that time. So I did change the setting. So I was
Okay.
in a hospital, and Sean's job at the time required that he would work night shifts. He would get called out for cases.
Hmm.
So there was a period of time where I was frequently having to change my shift, or sometimes I would just have to cancel my shift just because we were in a new city, we didn't have family in the area, and I had a new baby at home.
Mm-hmm.
So I just changed from hospital to clinic setting, and then when our
Okay.
schedules more aligned and we had more help, I went back to the hospital setting.
Gotcha. See,
Mhm.
and now, like, when we go to, like, I'm going to the ER, when you look at a nurse, we don't know all the behind the scenes things that,
Mhm.
nurses have to face.
Yes.
But what I want to ask is, when it comes to patient education, what have you experienced on your end, with what, the knowledge base that we as patients come to you, we have, and, properly advocating for ourselves? Just kind of give us some insight on that.
So, for the most part, what I see is that patients do not fully understand always their diagnosis, the treatment, and then what their options are.
Hmm.
Now, on a very there are some patients who understand completely what their process is, how to treat it, and can convey that to you when you're asking about their history. But
Okay.
over and large, a lot of patients really don't truly understand their diagnosis, um,
Hmm.
how the medications that they're using are treating it, and then long term, what are the things that I can do to help either improve my symptoms or to put me in a place where I no longer require medication. So,
Mm.
the big push for me and the big thing that I love about the position and the job that I am in now is that I can educate patients. I'm able to sit down with them and talk to them and review their medications and have them ask the questions: Why am I taking this? How should I be taking it?
Mm.
How should my
Hmm.
diet be modified to better suit my current diagnosis? And then
Hmm.
what are my options?
Mm.
And voicing those questions and concerns. So I feel over and large, people have a very basic or baseline understanding of their diagnosis, but a lot of times they really don't understand truly how their
Hmm.
medications work and their power also in their diagnosis and their treatment.
Yes, and I love what you said, because I know that for me, I got my thyroid removed, and at the time I was dealing with Graves' disease, which is a
Mhm.
oh, it's over the top with
Yeah.
that one. And I dealt with it for a while, and I didn't realize it was as bad as it was. And so the doctor had given me the option to, have it removed or have it partially removed. And so I kind of felt at a loss, because I was doing all this, research on the internet,
Mhm.
trying to understand, but I really didn't understand. The issue that I was running into was that the medication they were giving me, methimazole, but the medication that I was getting was also destroying my liver.
Mm-hmm. Mm-hmm.
And so, a lot of things we have to cut back on when our liver's at stake. And
Correct.
so, you know, going through that process, I didn't feel empowered to handle the situation. I didn't feel, educated enough to know what my options were. And so that I pretty much leaned on the doctor
Mm-hmm.
to tell me we need to go ahead and just remove this because it's not, looking good, and, dealing with heart palpitations and, anxiety and things of that nature. It became a very difficult and uphill battle. And so when a patient is, case in point, I'm saying all that to ask, when a patient is dealing with something like high blood pressure,
Mm-hmm.
what are some of the things that we can do to advocate for ourselves? And does the medication have to be, we're taking meds forever, or,
Correct.
do we need to take medication for high blood pressure? I've heard so many different things
Yes. Yes.
and I don't know the answer. So
Yes.
talk to us about that.
Yeah, so I did, and that's interesting because I know one of your questions that we had talked about was, is high blood pressure curable? I'd
Yes.
like to say it's controllable.
Okay.
Okay, so let's start. There are many factors that can contribute to high blood pressure. So it can be your weight, it can be your diet,
Mm-hmm.
um, and more overall, it could be just genetic, right? So I
Mm-hmm.
could be healthy, I could be doing all those things that I'm supposed to be doing, but I am just genetically predispositioned because of my family history to
Mm.
have to develop high blood pressure at some point or hypertension.
Okay.
So, given all those things, let's take off the genetic component. Let's just say I'm not the healthiest eater and I probably don't exercise like I should.
Mm.
Now, when you're in a position, because typically when you go in for your visit, your doctor will say, hey, your blood pressure is getting a little high. And the
Yes.
first option typically is, let's try to lose some weight. Let's try some diet. Let's try some exercise.
Mm-hmm.
So at that point, the ball's in your court. If
Mm-hmm.
you have the potential at that time to avoid having to take medications, if you take action on those things.
Mm.
Now, if you do not, your blood pressure continues to rise, then yes, the next step is going to be medication
Mm-hmm.
because we don't want your blood pressure to get to an extent where it's
Mm.
causing problems to your not just your heart, but your
Right.
kidneys
Mm-hmm.
and other organs. So
Mm-hmm.
yes, definitely at some point when diet and exercise aren't enough, or those aren't things that you've seriously taken into consideration and taken action on, then yes,
Yeah.
then we're at a point where medication is the option.
Okay.
Now, transversely, if it's genetic, you already exercise, you do those things, then yes. I mean, unfortunately, you can't you can't change your makeup, right?
Yeah.
So if your
Yeah.
mother had it, your grandmother, your uncle, you're more than likely going to develop it at some point. Now, definitely diet and exercise are very important. You should continue those things even if you do develop it at some point. But yes,
Yes.
medication is going to be what's going to manage it for you. Now, all that
Okay.
to say, if you want to pursue different options, definitely voice that. That should be a conversation you have with your physician or cardiologist if that's who you're seeing at that time. But
Mm-hmm.
yes, that is something that you should be able to discuss. But yes, in a lot of cases, um, medication is going to be what's going to best manage it. Now, over
Yeah.
time, can you get to a point where you no longer require medications? Absolutely. But
Okay.
if initially your blood pressure um, is at a level, let's say that it's so high when it's caught that the only option is medication, then yes, we need to get it under control. So even if diet and exercise are an option, if you're come
Mm-hmm.
in and let's say it's 200 over 130, we're going to put you
Yeah.
on medication because
Okay.
we don't have time to say let's
Yeah.
diet, no, we're going to treat and then
Yes.
implement those things. And yes, we're going to get where the plan is to get there.
Okay.
But initially,
Yes.
yes, that definitely. It should always be a conversation. There should never be a point where you feel like I have to do this and there's no other option unless that truly is. But that still should be a conversation. And you should be able to ask those questions.
Yes. And see, that's the thing, is that sometimes it feels like, and even in my past experiences with dealing with my healthcare provider is that they do was they put us where it's cheaper for, you know, if a medication is more expensive or if a
Mhm.
treatment plan is more expensive, they don't lean toward that one. They
Correct.
lean toward the cheaper. And I never understood why that is. Like if something is better for a person, that, you know, a more natural way or whatever, even though it's a little bit more costly, then why not push that first or try that first, you know, to help the patient to be able to heal or cure instead of going into the harsh treatment. Because I know for me it was my you know, the methimazole, like that really did
Mhm.
did a number on my my liver, you know, my internal organs. And so, you know, my husband and I talked about it. He says, is there any way that you can go see somebody else? And it
Correct.
seemed like for the most part, most of the doctors that I did see put me on the route to methimazole and not a natural, like if I was wanting to explore herbal
Mhm.
solutions, because I found an herbal solution that was called motherwort. So it was motherwort and bugleweed. I know this is way off, but
Yeah.
I'm thinking about these things
Yeah.
now, and I'm like, wait. So the motherwort and bugleweed is an herbal, like a drops that you can take. And I did a test, and I know I should not have, but I did a test to see how my levels would be affected. And actually, the bugleweed lowered my thyroid levels substantially.
Mhm.
But I would have had to take it on a more consistent basis, and it was a little bit more expensive, and I had to purchase it online.
Mhm.
But just wondering, is that a conversation that doctors have about the plan of treatment to go the route that's less expensive? And I apologize for that because I know we didn't discuss that, but as you were talking, I'm thinking about, you know, just different things that I've experienced personally that I know other people probably have experienced as well.
Yeah. I don't think any provider's thought is let's go with the cheapest route. I think all of us are thinking what is the most effective treatment,
Okay.
that's also cost effective for the patient and
Yes.
also will be approved by your insurance. So
Gotcha.
a lot of our decisions are based off your presentation, your lab work, and what research or medical research or studies have shown to be most effective, given whatever your labs or presentation happen to be at that
Mm-hmm.
time.
Mm-hmm.
Now, in some instances, a lot of instances, it's also tied by your insurance company. So
Okay.
I always encourage patients to also be familiar with your insurance company, what it covers, what your copays are,
Yes.
because a lot of our decisions as far as medications are also because your insurance requires certain formularies or a certain
Mm-hmm.
um, level of medications. So
Mm-hmm.
what might appear to be the cheapest route is what we know will treat what you currently present with, but also
Yeah.
will be covered by your
My
insurance company, won't
insurance.
be denied.
Mm-hmm.
And we're doing this circle, and you're still not being treated because lack of access to medication,
Mm-hmm.
and then also what's cost effective for the patient. So I'm not going to put you on the most expensive medication if there's an option that's equally as effective that's more affordable for you.
Mm-hmm.
So
Gotcha.
that's what dictates a lot of decisions regarding medications. Now, to your point of trying something herbal or a homeopathic option, again, discuss it with your doctor. If because to your point, you said you had spoken to a few other physicians or specialists
Mm-hmm.
who are also on the same path, then there must have been something about your lab work that indicated that this was the best option for you. So I
Yeah.
would encourage you in that case just to ask why.
Mm-hmm.
Why is this medication better? Why did you choose this one? And if they're open to you trying different measures under their watch. Okay.
Okay.
You don't ever want to try anything and stop your medications without the supervision of your physician because you just, that can change things drastically.
Yes.
And you want them to
And I
be, yeah,
learned that. I did learn that. I
yeah,
did.
that's what we're here for. We're here to help you, to
Mm-hmm.
educate you, and to put you on the best path to have optimal health. Okay. So
Okay.
that I would encourage, always just ask. Don't be
Mm-hmm.
afraid to ask why,
Mm-hmm.
and then explore other options if they're open to it. And if you don't feel like your physician or provider supports it, then it's also okay to find one who does. If you're more interested in more alternative or herbal options, find a physician who supports that and is open to trying different avenues other than what
Mm-hmm.
you would typically see.
Okay. That makes sense. So when it comes to, can you talk to us about our rights when it comes to surgery?
Correct.
So I don't know much about it. Like when we're going getting ready to go into that mode of surgery, what some of our rights are as patients.
So your right is always to fully understand what it is, the procedure that you're having, um, what are the side effects,
Mm-hmm.
outcomes, and expectations. And that should
Mm-hmm.
be a conversation you've had in detail with your surgeon prior to signing any consent. So you should never feel forced into any surgery. If surgery is something that is suggested, definitely talk about it. If it's something you don't agree with, absolutely get a second opinion. In
Okay.
emergent situations, it's a little bit different, but still, at the end of the day, the consent that you sign, you should have read thoroughly. And if there's anything that you do not understand, do not sign, and have
Mm-hmm.
the physician come back and answer your questions to your satisfaction before signing
Mm-hmm.
the consent. So you have the right to say no. You have the right to not sign the consent until you fully understand what it is that's written there,
Mm-hmm.
including the side effects, the outcomes, and the expectations. So a lot of times we go into surgery not understanding uh, the expectations of the provider or the surgeon after
Yeah.
surgery, right? So that
Yeah.
needs to be a real conversation as well. If I'm having knee replacement, oh, I didn't know a few hours after I wake up, I'm expected to get up and walk around. You need to
Mm-hmm.
understand all of those expectations, follow up, any therapy that might be required, because that might come at some cost to you. So
Yeah.
you need to understand everything, but most importantly, understand what it is that you're signing for, which
Mm-hmm.
surgery specifically you're signing for. Also making
Mm-hmm.
sure that it's the right
Yeah.
extremity, right location. You want to check all those things, but at
Yes.
the end of the day, you want to understand everything about the procedure that you're having, and the possible side effects or outcomes.
Okay. That makes sense. So, and I know that we've talked a lot about, and you've gone through a lot of the questions that I wanted to go over with you. We talked about the high blood pressure as being controllable. It can be controlled, but can it be cured? Can we go back into that? Because I think I remembered. I don't remember if you mentioned that part or not. But can the high blood pressure part be cured? And just kind of go into some preventative things that we can do as patients. Because I know we deal with our blood pressure. We deal with so many a variety of issues that we have, even now, knocking at the door of mental health. As patients, we struggle with that as well.
Mhm.
And I know some providers are experiencing that more now than before due to COVID. There's been a rise in patients struggling with their mental health, and so just kind of talking about and wrapping up the blood pressure aspect, and then going into the mental health part, if you will.
Right. So if you have a diagnosis of high blood pressure, or what we would say is hypertension, then no,
Hmm.
cured is not the word I would use. It can be
Okay.
controlled.
Okay.
Um, as with most diagnoses, if I'm a diabetic, even if I no longer take medication, I still have diabetes. It's just controlled. It's
Mm.
controlled either with diet or exercise, or
Mhm.
it's controlled with medication. So it's interesting because I had a conversation with a colleague not long ago about this. So you might ask a patient's history, and they'll say, no, I don't have high blood pressure. No, I'm not a
Yeah.
diabetic.
Yeah.
And then you look through and you're like, but you take these meds. Well, it's because it's no longer high, or I don't have high blood sugars anymore. It's considered they no longer have the diagnosis, and that's not true. It's just controlled.
Mm.
It's just controlled. So
Okay.
I wouldn't use the word cured. I'd say it's controlled. Now you can
Mm.
have high blood pressure, um, like and not have the diagnosis yet. We can just say your blood pressure is running high. So don't confuse the two. So if you have been told your blood pressure runs high, it's a little high, but you're not currently being treated, then
Yeah.
that distinction is a little different. But if you're being treated for high blood pressure, even if at some time it's controlled and you no longer require medication, you still have high blood pressure. It's just controlled at the time.
Gotcha. I didn't know that. And I thought once your blood pressure gets back to normal,
Mhm.
it's no longer high blood pressure, then that's it. We just work to keep it low
Control.
and,
You have a
do what we need
history
to
of
do.
hypertension that is controlled with diet and exercise or whatever it is that you might be doing at that time.
Gotcha.
Mhm.
Okay, that's a good point because I had no idea. I thought it was like when it was done, when your blood pressure goes down, that's it, and you just do apple cider vinegar and veggies and
Mhm. And I mean, those things work. I mean, you can control, you have power in controlling those things. Absolutely.
okay.
You can control it with diet exercise. You can try it with those remedies. I mean, those things work for you. Again, under the supervision um,
Yes.
and the consent of your physician, then
Yes.
absolutely.
Okay.
Absolutely. Hmm.
Okay. So now going into the portions, I know we had our conversation. We are talking about also dealing with mental health and something that I would like to add into this episode and just kind of inquire of you, just some things that you've experienced in that area and some guidance for patients that that may be struggling with their mental health. Can you speak into that area?
Sure. So, mental health, especially in the African American community, is something that isn't definitely not as taboo as it used to be, but it's still something that I think as a culture, we're still getting comfortable with saying, hey, I suffer with depression or anxiety or even bipolar or schizophrenia, whatever your diagnosis may be. I think we're just now getting to a point where it's something that we feel comfortable discussing and
Yeah.
saying, hey, this is something I struggle with.
Hmm.
Um, so, in that vein, we're now also dealing with lack of access. So, I mean, historically, as African Americans, we lack access just in general to even basic care. So now, when
Hmm.
you're talking about a specialized care where there are already a shortage of providers who can provide care or resources, I mean, we're even more at a disadvantage.
Yeah.
However, I think the important thing is one, and acknowledging that this is something that you are struggling with, and
Hmm.
being okay with that, and
Yeah.
seeking the help that you need. Now, the first step is, of course, if you're established with a primary care physician already or provider, then having that discussion openly with them,
Mm-hmm.
because they can initially start you on medications to help with that, and then if you feel like that you need some additional counseling or additional specialty like with the psychiatrist, then getting those as well. And again, if you're established with a primary care, they can refer you or you can go through your insurance company to
Yeah.
schedule getting that. So I
Okay.
think the biggest barrier initially is just ourselves.
Yeah.
It's just saying, hey, I need help. And then
Hmm.
not only saying it, but then acting on it and doing those things to put yourself in alignment to get access to those things.
Hmm.
So don't let anyone be a deterrent, family, friends, even in some instances, your providers. If you feel like what is being offered at that level is not sufficient, then definitely go see a counselor, go get
Hmm.
additional resources, go do those things, go see a psychiatrist. So
Yeah.
again, you are your own best advocate. I always tell people, trust yourself. You
Hmm.
know yourself better than anyone else there.
Yeah.
So my goal is to help you to get to your best self, but I can
Hmm.
only do that with your assistance and your help. So if there's
Yeah.
something that's not working for you, if there's something more that you require, if there are questions that you have, share
Hmm.
that because we're a team. We should be able to
Yeah.
work together to get you to your best self. So
Yeah.
mental health is the same way.
Hmm.
Share what your concerns are, share what your issues are, share what
Hmm.
your barriers might be, and
Hmm.
then work with your provider to get you to a place where you feel like all your needs are being met.
Yeah.
There are also a lot of resources available online as far as you could um, look the American Psychiatric Association. There are
Okay.
also other websites that offer. You can look up for providers in your area.
Hmm.
So definitely reach out to those resources that are available to you as well. Your local community,
Yeah.
your Department of Human Resources. There are just so many different avenues, but the important thing is to be persistent
Mm-hmm.
and make sure that you get what you need.
Yeah. Yeah. Definitely. So, guys, we've talked about a couple of things here. We've talked about patient advocacy, advocating for ourselves, dealing and interacting with and meeting with our primary care provider, and just some basic patient rights that we have to be able to ask questions and, not fear or feel as though we can't ask those questions.
Hmm.
I think it is very important that we're able to do so. Even, for me with my recent experience with having surgery and, just being really nervous about that whole process. It changed surgery can change your life forever.
Absolutely.
And, medicate going on medication. Some people don't want to go on medication. Some people feel like they don't need it, but if your healthcare provider is suggesting, hey, this is the best route to be able to get this under control, and then we can explore other options,
Hmm.
and that's a good way to go. But I love what she said, that that you and your provider are on the same team,
Hmm.
that they're there to provide you with the assistance. And to be able to trust that our doctor has our best interest at heart is the biggest thing.
Yes.
Sometimes, for whatever reason, there's always a different opinion where a doctor has, some other experiences with a certain area, and then
Hmm.
they could say, okay, well, no, we're going to try this first because I've seen this work in other patients. And so you may need to seek another opinion. And I've seen, had family members in situations where they've gone that route and sought a different opinion. Even in the case with my mother, just passing, I think we contacted about two or three doctors outside of the hospital that she was at,
Hmm.
just to make sure that she was getting the best treatment. And it was the majority did state that because COVID, she had passed away from COVID.
Hmm.
And, just because of that situation and what they've seen with all the underlying health issues, that we have to trust the provider. We have to,
Yes.
we
Yes.
got to trust that they're going to do the best that they can. And it was very difficult. Some things are very difficult for the families to go through, and healthcare providers get the blunt end of
Yes. Yes.
the emotional onslaught
Yes.
of issues that families may have. And so mental health plays into that a little bit.
Hmm. Hmm.
That
Hmm.
after those traumas that we deal with, sometimes we do have to reach back and treat it and get help, talk
Absolutely.
to somebody and deal
Absolutely.
with, some of the things that we may be experiencing, whether it be grief or whatever the case is, whether it
Yes.
be, dealing with issues in the home or, um, whatever it is that we're going through. And when we interact with our healthcare provider, they have to know where we are.
Yes.
And
Yes.
all that to say that
Yes.
they have to know where we are so they can point us in the right direction, get us on the right path to get the help that we need, because we want to be our best selves.
Yes. And I want to say something because you make a good point. So we are definitely in an era where most people do not really trust their healthcare provider.
Yeah.
Either for a point that you made about, not giving me the best medications, or
Yes.
surgery being a first option as opposed to other alternative measures, or
Hmm.
just that the provider just doesn't have my best interests at heart.
Hmm.
Now, I would say healthcare has changed. So I understand myself being a patient most recently, not long ago in the ER. The healthcare is not the same as far as the relationship and the time that you used to get with a provider. And there are
Hmm.
many factors that play into that. However, I would also encourage you to give your provider some grace. Um,
Yes.
Give them some grace. We are working under uh, a different circumstances, different work conditions. There are a lot of underlying things that we also face as providers with, shortage of staff, shortage of time.
Yes.
There are just a lot of different factors. There are constraints
Yeah.
as far as insurance, and what we can and can't do. So there are a lot of different factors. But
Mm.
all that to say is, for the vast majority of
Yeah.
providers, we are here to help you. Most of
Mm.
us, if not all, went into healthcare because we felt some type of connection with it and wanted to make a difference. Either it was through our
Yeah.
own personal experiences or with family members, or that was just, the purpose that God placed in our life for whatever reason. And
Yes.
so
Yes.
when you have that heart of compassion, when you have that heart of giving and caring for patients, you do that. Now,
Mm-hmm.
there are other extraneous factors that might affect how it might be presented at that time. But at the end of
Yes.
the day, most of us, if not all of us, want what's best for you. So I would
Yes.
always say, of course, trust yourself. But I would also encourage you to know your insurance. So know, and I say that because a lot of misconceptions about why the provider makes the decisions that they do is simply because your insurance company requires that we do certain things, or that, for instance, you say, to try the cheaper medication. Your
Yes.
insurance company said you have to do these before we will pay for this next tier of a medication. So know
Yes.
your insurance. Know what they cover, what they don't, what they
Mm-hmm.
require. While this test might be the optimal test to diagnose
Yes.
a particular disease or condition, your insurance
Yes.
said
Yeah.
no. You're going to do this one first, and then if
Mm-hmm.
this one shows, then we'll do the next one.
Mm-hmm. Mm-hmm.
But also be prepared when you go to your primary care physician. Know what medications you take. Know your
Mm-hmm.
family history. Those things
Mm-hmm.
are important and will direct a lot of the decisions that are made as well. Again, don't be afraid to ask questions. If
Yeah.
you're not sure, if you don't understand, don't walk out that doctor's office and you don't know
Yeah.
why you're taking those medications, or
Yeah.
why you're getting this test, or why this surgery might be recommended. Ask,
Yes.
definitely
Yes.
ask. Ask those
Yeah.
questions, take notes, and then give feedback. So you
Mm.
can kindly disagree with your physician, and that's a good conversation. I mean,
Yes.
don't assume the worst and then
Yeah.
just become irate and you just trying
Mm-hmm.
to kill me, and don't do all that. You can just say, I disagree. Are there
We
some
do it to
other options?
ourselves.
Yeah, just agree to disagree, and
Yeah.
either you all can come to an understanding or a common ground, or you can say, you know what, I'm going to seek a second opinion about this because I want to
Yeah.
pursue some different options. I mean, at the
Yes.
end of the day, remember why you're there. You're
Mm-hmm.
there because you have some concerns about your health, or you're just trying
Mm.
to make sure that everything's okay, that you're
Yes.
in good health and maintain it, and be your optimal self. So make sure that you're in partnership with your physician to make sure that whatever your healthcare goals are, that they're being met.
That's good. That's good. Yeah, definitely. Definitely trust in the healthcare provider, because in this day and age, more and more, I am seeing that, even with interacting and dealing with, family, and just
Mm-hmm.
conversations that we all have with our family, and how hard it is. I feel very fortunate that we found a doctor here, and she treats our entire family. She's got me, Maurice, and Nevaeh, so we all share with her all the things, so she pretty much knows the
Mm-hmm. Mm-hmm.
entirety of
Mm-hmm.
our family, and she's amazing. And even so much, Nevaeh has her phone number.
Oh, that's
Like,
wonderful.
yeah,
Oh, that's
but
great.
when Nevaeh met her, because I said, we're going to go here, this is going to be, this is the family doctor or whatever. And just kind of walking with Nevaeh through things, Nevaeh said, I would actually have coffee with her. We got in the car. That's how she felt about this
Yes.
doctor, is that, Mom, I would actually have coffee with her if she would have me. Like, she really did,
Yes.
genuinely, she felt like that our doctor truly did love and care for her, and she does.
Good.
Just being with her, and just kind of her assisting me through this final stage of getting the surgery, that she knew toward the end, it got my, because my thyroid levels got really bad
Mm-hmm.
when we got here. And I think the stress of moving here
Yes.
and all those things just kind of compiled, and she was so instrumental with helping me through that final stage and getting towards surgery. And I felt a whole lot different when I did get it removed. And so, if anybody's considering getting that thyroid removed, definitely talk to your doctor, your provider first.
Mm-hmm.
But it did help a lot, a substantial amount.
Good. Good.
So,
Good.
but pretty much that was, guys, I really, like I said, I feel fortunate. I'm gonna have Angela come to my next doctor's appointments. No, I'm just kidding. That way she can advocate for me, and then she'll know all the words and stuff. And then she'll be like our
Oh,
spokesperson and in our purse.
yes, lean on your people. I mean,
Yeah.
absolutely. If you have family members or friends who are able to assist you and have that knowledge base, definitely use them. Have them,
Yes.
call them during while you're in your visit.
Yes.
Absolutely. If use all the resources that are available to you, for sure.
Yes.
Absolutely.
And I love what she said about knowing your insurance because we don't always think about that. We don't
No.
always think about, I need to call my
Mhm.
insurance company just to find out what they're going to approve, what they're not going to approve,
Yes.
and just understanding the small print when it comes to our insurance company. So I love what you said about knowing your insurance company and
Yes.
what it covers because that's going to
Yes.
determine the medications, the treatment, and the whatever that, I don't want to say package, but whatever plan of care
Correct.
that you're going to
Yes.
be able to get.
Yes, and you
Um,
can appeal decisions. So you just know that that is an option as well. If
okay.
the insurance company says no, this is not going to be covered, you have the right to appeal any decision that they
Okay.
make. You can appeal. And as far as medications, if you ever run across medications that are prescribed that you can afford because the copay is outside of um, what your budget allows. There are prescription assistance programs, and sometimes even the pharmacology company or the manufacturer of the drug offers some resources as well. So also see if that's available for you. That you can afford because the copay is outside of um, what your budget allows. There are prescription assistance.
So I apologize for that. We were having some technical difficulties right at the end of the conversation, but before got booted out of the system, we were discussing knowing your insurance and knowing the coverage. And so, Angela, could you continue that and just wrap that conversation up
Yeah,
for
so just
us?
knowing what your coverage entails, what benefits you have, and then I was also saying that if there's ever a decision that's made that you do not agree with, you can always appeal any decisions that your insurance company makes. And then if you ever need assistance with medications, you should always ask your physician if there is a prescription assistance program associated with that medication, or if the
Okay.
manufacturer of the medication sometimes offers grants or will cover your medication for a year or offer some type
Yes.
of financial assistance with the medications. So those are just also
Hmm.
things just to be aware of that are options that are available to you.
Awesome. Awesome. Well, thank you so much. I really appreciate your time tonight. I know you're a very busy woman. Guys, she's got girls and girls, girls, girls. So I know that she's very busy. And I just know that she has a lot going on in her own personal life. So I appreciate her taking time to carve out, some time to discuss healthcare with us. She's definitely has a servant's heart, and I really appreciate all that she does. She actually visited me. I was sick and shut in, and so she came by our home, and I was like, "Oh my God!" Some words like Angela's here, and I was like, "What?" But I was down a few days ago, and definitely feeling a lot better, and enjoyed her soup, her gift of soup, a home cooked meal, which I needed so badly. I couldn't. I Of course we know I had COVID, but I couldn't taste it as much. But I did taste the meat, so that was good. So my taste buds are returning to me slowly.
Yes.
There's certain things that I'm noticing are kind of coming back to me. The sense and stuff like that's returning. But I definitely appreciate her heart and her willingness to do this and to support the podcast. And guys, if you have any questions, please feel free. Don't hesitate to reach out to me, and we'll get you the best answers that we can. I appreciate all of our subscribers and those that are listening. We see you. We know that you guys are engaging, and so we're thankful for you. We don't take it for granted. I'm thankful for the feedback that you guys are giving, the positive words of encouragement for this platform. Um, if you don't already know, this platform is not primarily built for me, but is built for others to learn, because I believe each one teach one. We can all learn something from one another, and we're helpers one to another. We can, there's information in somebody else's life that God can give us access to. And so I would love to use this. I love to use this platform just for that, to be able to share good news, to be able to share knowledge, to be able to share insight and a word of encouragement. So with that, we're going to Angela. Do you have any closing remarks?
Yes, I just say always be true to yourself. You're your own best advocate. Always ask questions. If you're not pleased with the care that you're receiving, definitely seek a second opinion and make your voice heard. So don't be afraid to ask questions, to ask for help, to seek other resources, and always trust yourself.
Awesome. Thank you so much again, guys. And Angela, I'll give you a call when we're done.